Hello and welcome to all of our Gold Learning viewers. I'm Fiona Lang-Sharp, IBCLC and Director of Communications here at Gold Learning. Well, welcome everyone. Today we have Amber, Valentine, and Lillian Scott, and we've got Amber on the line right now. We're going to be chatting with her in just a moment, but they are going to be speaking at our upcoming Gold Lactation Conference here at Gold, and they're going to be jumping on live during that conference, which is really exciting. So you'll have an opportunity to come and chat with them live. Book it on your calendar now. It's April 16th. You'll have to check all the local times, of course, on our website. The conference itself kicks off with our free keynote on April 3rd, so there's lots going on here. So I'm just going to remind you again, it's goldlactation.com. That's where you need to go to find out all these details afterwards that we're going to be talking about. But as you can see on our screen, Amber and Lillian are going to be talking about infant feeding difficulties, a look at high-risk populations. So this is, of course, a really important topic for all of our lactation consultants and those that are training up to be in the field, and I can't wait to hear what they have to share with us. But first of all, I really want to introduce you to the team that's going to be speaking to this, and as I mentioned, Amber is here with us right now. So Amber, I'm going to ask you a few questions here, a little bit about yourself, and then a little bit about what you do. So here goes. So first of all, I would love it. Please introduce yourself to the audience who's listening today and tell them what you currently do.
Well, my name is Amber Valentine. I'm a speech pathologist who is board certified in swallowing and swallowing disorders and an international board certified lactation consultant. I work in a level 3 NICU that has about 34 beds and also do pediatric outpatient feeding and modified barium swallow studies.
Wow, that's incredible. So your life is pretty full then, I imagine. You're busy all the time.
Extremely.
And I'm sure you're very passionate about it too, because I know this is very important to you. I wanted to talk a little bit about some of the area that you work in, and of course, you know, you're going to be talking about a high risk population. But what really does inspire you with all this, you know, full-time job, working, and all the rest of it, and here you are, you're speaking on this subject too. So what inspires you, Amber, to do the work that you do?
I think it's trying to give the best help possible to these mother-baby dyads and the families that feel like, especially with this population, that they're at the end of their ropes and feel
Mhm.
like they don't have a lot of support in this situation, and just trying to give them the most success that they possibly can for feeding.
That's awesome. And of course, you know, being that it's such a, you know, it is a very, it's I mean, it's a big area for you, but it's a smaller area for a lot of us. So it becomes very unique. I mean, you are probably a bit of a lifeline for a lot of people when you're in the NICU and they're looking for a little bit of hope and inspiration. I mean, I'm sure you talk to many mothers, but how is it for you, Amber, when you're approaching them? Because they're going through so many emotions of what's happening in their lives. Some of it is a shock to them. Other times they've known ahead of time. But what has, you know, what inspires you to keep working in this very, you know, sometimes difficult situation?
Well, I feel like with Lillian and I having a very specific niche in this field, that oftentimes we become the sounding board for these parents, and we take on a counseling piece, not just that we're trying to problem solve, but we are just listening to them and kind of
Sure.
helping lead them in the right direction.
That's incredible. Well, we're glad that you're there, and I know it's going to be really good for all of us working in the field to hear more and know how we can support this very specialized area. Tell me just briefly what you're hoping that to share with our listening audience during your presentation. What are you hoping that they'll take away from this presentation?
I think one of the biggest things that she and I both hope that people take home is that all babies are capable of this, and that all babies should be given an opportunity, and families that in the like, to give the opportunity for successful feeding.
Oh, and isn't that the truth? I mean, it just sometimes it's missed opportunity, I find, when I hear retrospectively that there was never an opportunity given. And that's something that will, you know, we're indebted definitely for the two of you for doing. So certainly appreciate that. Okay, well, that's good. Now I've got a little snippet from you, Amber, and I'm going to ask you to pass that headset over, if you could, to Lillian so that we can get a chance to introduce her to the audience as well. So if you wouldn't mind doing that, that would be awesome. And we'll
Okay, I'm
just
here.
have Lillian come on here. Hello, Lillian.
Hi, how are you all?
I'm good. It's really good to have you here. And now that I've drilled Amber, you're gonna have to come up with some unique answers now,
All right, keep
Lillian.
it
So
going.
so why don't you start off again? And I asked, I'm asking you the same questions, but perhaps just introduce yourself to the audience. Tell them what you do, where you work, and what you're currently working on.
Well, my name's Lillian. Amber has actually been my mentor for a number of years, so I can just take what she said a lot of times. I also work in the NICU and see outpatient breastfeeding and infant feeding dyads. And so we're in
Mm.
Kentucky.
That's wonderful. And so perhaps I can ask you then, Lillian, what inspired you to move into this area? How did you get involved in this field?
For me, it started out getting an experience in speech pathology in the acute care setting, and then having Amber as a mentor in my NICU training. I realized that not as many moms were breastfeeding as what I thought would be the expectation in my head. So that led me to pursue the IBCLC and become more engaged with infant feeding from a breastfeeding perspective and the difficulties they have when they're born premature.
Yeah, that's just wonderful. Well, it's great to hear that, that Amber was a mentor to you, and now you've ended up working, collaborating together and speaking together, which is fantastic. So, and I did ask Amber a little bit about, some of the challenges. This has got to be quite an intense job at times because you're dealing with a lot of different things. Amber mentioned that, there's counseling involved, obviously, being that, these families are sometimes in shock and trying to deal with so many other things. What inspires you to keep working in such this intense field sometimes, and keeping you moving forward?
For me, I think part of it is seeing the success of the patient. Sometimes, especially in the outpatient setting, we get some really complicated cases where babies may have feeding tubes as well, and then moms are trying to balance breastfeeding or pumping and expressing milk while balancing the nutritional needs and feeding difficulties of their complex kids. So, looking at it from a counseling and problem solving perspective, but also seeing how the families grow and improve as babies and mothers meet their goals is really inspiring.
I can imagine, and the rewards that, as I've mentioned, I've met many families. I know that Amber was mentioning giving them opportunity, and sometimes families don't get any opportunity. So it's amazing that that you're there as a team working together and are inspired to keep working in this area. So thank you for your dedication to all of that. So lastly, I'll just ask you about the actual presentation. What is it? Give me one little snippet that you're hoping that people will take away from this presentation.
I think that breastfeeding is possible, but sometimes we also need some supports. And how can we support and continue to grow the breastfeeding aspect of the relationship when there is an infant feeding difficulty due to a complexity such as cleft palate um, or NAS, one of those complexities, that breastfeeding is still very much an option and something we should continue to support and encourage, and how can we support that through other modalities as well.
Well, that sounds very exciting to me. I think that sometimes, things come into our realm that we're not familiar with. You're an expert, in this area. And so I'm looking forward to really learning more from both of you. It's an area I haven't looked at for quite some time. So this is really exciting to have you here personally, and of course professionally here at Gold. So thank you so much for being part of our program today. And thank you for being on the spot today and answering some questions about yourselves and, of course, about your presentation, and what you do back home there. So thank you again. So I'll just wrap things up here for our audience who are listening in. Just a quick reminder, April 3rd is the date that you want to mark on your calendar. of when our conference opens. Please come and join us for the live presentations. It really gives us an opportunity to engage with our speakers, and they will be here answering questions on the spot, giving opportunity for you to really sort of delve into this topic, particularly this area that doesn't often get enough credit. And so it'll be great to be able to really have that time with Amber and Lillian. They'll be live with us on April 16th. Now, if of course, if you can't make that, we understand. Please note that you'll have opportunity right the way through the conference to listen to the recordings as many times as you like. So another great way, and of course, exclusive to our Gold delegates, we have our Gold forums as well, where it's our ongoing conversation about this topic and all the others that are coming up as well. Well, thank you to Amber, Valentine, and Lillian Scott for joining me here today, and we'll look forward to having you back really soon. And thanks again to our listening audience. Bye bye for now, everyone.